Hey everyone, it's Naomi. As promised, I'm going to give you an update on my MRI results and all of that stuff. So my MRI results came back showing that all of the cage and the screws are in place, thankfully, so no problem there. What it did show was a cyst that has developed on the spinal cord and is actually pressing on a root of a nerve. So it's possible that is what caused my pain, and if it is that, it had nothing to do with the sex. So possibly, there was some inflammation that simply pressed on that further. I'm not sure what I'm going to do about this cyst. It says that at the moment it's small, so I imagine we're just going to sort of keep an eye on it. Other than that, it showed that there's some atrophy in the muscles around the site of the surgery, which I think is fairly normal, as they have to, cut the muscles and they damage them during the surgery. So I think that is fairly standard. Not sure if I'm supposed to be doing special physio for that, but anyway, I will go back to my surgeon and discuss those things. He did see the MRI and told me that I was safe to fly, but I haven't seen him since we got the full analysis of the MRI, so I will go back to him for that. But I'm doing a lot better now. That pain that I had, it was quite severe for about a week, and then it gradually reduced, and now I'm not really in pain. And I did fly to America and back, and that was at one point a 10-hour flight, and then a 4.5-hour flight on the way there, and then an 8.5-hour flight and a 4-hour flight on the way back. So it was a lot of sitting. I was quite anxious about it, but actually it wasn't too bad. The 10-hour flight was the hardest. The seats of the plane were quite comfortable. It was Swiss Air, but they don't have very much room between the rows. Like, the aisles are very narrow, so when my back was hurting, I couldn't stand really because I was always in the way. So I had to sit for most of that 10 hours, and my back did ache then, but it didn't continue aching afterwards. The next day I was fine. So I'm doing pretty well. I'm back to kind of normal, occasional sciatica pain, which now I assume is from this cyst pressing on the nerve. That's it, but the fusion looks good, and all of the screws and everything are in place, so I don't have to have them removed. So pretty good news. That's it really. I guess I'll let you know if I have to actually do something about this cyst. From what I understand, it either has to be surgically removed, or they sometimes inject some sort of a glue into it. The cyst it's basically filled with spinal fluid. So if it gets bigger and it presses down on the nerve more significantly, it can cause problems. So I really hope I won't have to do anything about it, but I imagine we will every once in a while do an MRI to check where that's at. But for now, it's February, so almost a year and 3/4 since my surgery. I'm doing well. Back to walking around. Sex is good, normal. As I've said before, me on top is a bit painful for my back still. But other than that, pretty much back to normal. Whatever we feel like doing, we can do. And still doing the EMS training. That's going really well. So that's it. So I'm happy to give you a more positive update, and I will let you know as things develop. Feel good, everyone. Take care.